Hi everyone, welcome to Gist and Unwind, where we unwind, and we learn in the process. I'm Nonye, and today I have a pharmacy episode for you. Today I will be talking to you about burns. So, once upon a time, I was in the pharmacy, and a woman walked up to the consultation window and she opened up her shirt and she asked me, "What do you have for this?" So, I look at her shirt, or her chest actually, and I see some peeling going on, a little bit of redness. And so I asked her what happened. So she told me that she was just making dinner and she was making spaghetti. She was boiling water for the spaghetti. And as she opened the pot of boiling hot water to put her spaghetti inside, her children, who happened to be playing in the area at the time, one of them dropped a ball into the pot and it splashed up at her, landed in her chest area, and it scalded her. So she yelled at them and quickly drove to the pharmacy to ask the pharmacist, who happened to be me at the time, what I recommend for such a scenario. And um, and I recommended something for her. And before I tell you what I recommended, let me talk to you briefly about burns. Please allow me. Um, First, it is, how prevalent is it, and how can we prevent it? I can tell you, without boring you too much with statistics, it's very prevalent, especially in the elderly and in children. It's a question that I get quite frequently in the pharmacy. A lot of times, either people who burnt themselves or they know someone who burnt themselves and they're just looking for a recommendation on products they can use to help them heal. So it's something that's quite prevalent. So as a result, I think prevention is something that I would like to just briefly touch on. The bottom line is, we can never be too careful. We can never be too careful. With children, if you're cooking, try to cook in the back burners of your stove. If you have children, you know that they tend to grab and try to reach and grab things. And if you happen to be cooking in those first burners and they reach up and grab it while it's still hot, they can really hurt themselves like that. If you're serving food to the elderly, watch the temperature of the food that you serve them. That's often how they burn themselves. If wherever you live, try to have an escape route in case a fire breaks out. Again, the bottom line is, we can never be too cautious, we can never be too careful when it comes to this fire thing or burns. So let me describe to you how we define burns and how we define the severity and seriousness of it, which, as you can imagine, depending on how serious and severe it is, some things we can't take care of in the pharmacy setting. You would actually have to go to an urgent care or an emergency room or hospital. So our skin is in three layers. And I want you to think of this three layers as a sandwich. And in this case, we're going to go with a double cheese sandwich. So we have two slices of bread and two slices of cheese inside, in between the bread. So if a burn affects just that first slice of bread, what we have is a superficial burn. These burns look red, they're warm to the touch, and they hurt. An example of this would be a sunburn. If the burn goes beyond that first slice of bread into the first slice of cheese, what we have is what we call a superficial partial thickness burn. These also are red. They are they're warm also, and then they're a little bit more wet. You have blisters with these. And then if it goes beyond that first slice of cheese to the second slice, we have a superficial deep thickness burn. And these have larger blisters. They look a little bit more pale than the more superficial burns. And the reason is that, at this level, you've now started burning and hurting the veins that supply that area with blood. So it starts to look a little bit more pale. And then if you burn through those cheese and go to the second slice of bread, now we have a full thickness burn. These burns are dry, they're leathery, and supposedly they don't hurt, because you've actually burnt the nerve endings and burnt everything, so you're not feeling any sensation from there. But the thing is that burns are usually not completely uniform. for example, if you have a burn, some parts of your wound might be full thickness, some parts might be superficial. So it varies. So it's rare. I wouldn't say rare, but even though you might have a full thickness burn, you could still be feeling pain from the surrounding areas that have a less deep burn. So that's the way we define burns and define the severity of it. So, what can we take care of in the pharmacy setting? Before I tell you that, let me tell you what we cannot take care of. So, if you have any of this and don't even bother going to the pharmacy, just go straight to the an urgent care or an emergency room. Number one is if your burn is has affected more than 2% of your body surface area. If it's a superficial partial, that is, it's burnt through the first slice of bread, it has affected the first slice of cheese, but it's more than 2% of your body surface area, we can't take care of it in the pharmacy. I know you're probably wondering, how do I know if it's 2%? A quick way to estimate that is if you look at your palm, one palm is roughly 1% of your body surface area. So if the area of your wound is more than 2% of your body surface area, just go on ahead and go to the emergency room or an urgent care. If the burn affected your eyes, your ears, your face, your hands, your feet, or your groin, again, we cannot take care of it in the pharmacy setting. If it's a chemical burn or an electrical burn, we can't take care of it in the pharmacy setting. And if the victim is someone of advanced age, it's better that they go to the it's better they go seek more medical help than we can give them in the pharmacy setting. And then if the person is immunocompromised or has multiple medical disease states like diabetes or anything that makes them immunocompromised, then they should also head to the emergency room. So those are things that we cannot take care of. So what can we take care of? Clearly, we can take care of mostly what we can take care. Excuse me, I'm sorry. What we can take care of mostly is your superficial burns. So that's just that first slice of bread and the second slice of cheese if it's less than 2% of your body surface area. So what can we do? First thing is we have to first run cool water in the area to kind of cool it down. Run cool water about 15 minutes to the burn area. And then beyond that, we now have to determine if your skin is broken or not. If your skin isn't broken, just some skin protectant would do. Something like Vaseline or cocoa butter, or if you have access to shark liver oil, which has a lot of vitamin A in it, you could just apply that on the burn and it should heal within 6 days or within a week. It should heal and with minimal or no scarring actually. But now if the skin is actually broken, now we have to worry about infection. And you still run the cool water in the area and you could wash and clean the area with bland soap and water. Just bland soap, like baby soap. Nothing fancy, nothing sophisticated. Just plain bland soap, like baby soap, and wash that area. And then after that, you can apply just over-the-counter antibiotic. Or if you have access to Silvadene, which is what is often prescribed for burns, you can apply that. It's an antibiotic, but if you live in the US, you need a prescription for that. So you might not have access to that if you're not going to seek more urgent care. Otherwise, you can just apply over-the-counter antibiotic. And then also, if you could also apply a dressing on the wound, depending on how big it is or how extensive it is. What's important is that your wound has a moist environment to heal. Moist environments are the best to promote healing and reduce your scarring. So to do that, you would apply a dressing on it, which they sell. There's different types of dressing depending on what your wound is doing. If it's a weeping wound, if it has a lot of fluids, a lot of exudates coming out, you would use a foam dressing on it. That foam would absorb those liquid but still kind of help keep that area moist and help you heal the best. If you don't have a lot of exudates coming out, if it's not a very productive wound, as in there's not too much liquid coming out of it, you could just use what we call a hydrocolloid dressing. Again, that will keep that moist environment that we need for optimal healing. Um, so that's pretty much it for these superficial minor burns for over the counter treatment. Let me talk to you about honey and aloe and your vitamins. Aloe is often used to heal or take care of wounds, and I did some research on honey and aloe. What I can tell you is that there is not an overwhelming evidence that these agents help, but there is enough to suggest that it helps and it doesn't hurt to try. So if you have access to aloe, especially fresh aloe, you can go ahead and apply it on the wound after you wash it with that bland soap. Same thing with honey. Honey actually has some antibacterial properties as well, so you can apply it on there. Vitamins, if you are vitamin deficient, then it will be in your best interest to take some vitamin supplements in general anyway, but especially now that there's a burn, it's going to help with the healing process. And it doesn't hurt to just take an extra two, not an extra, take 2 grams of vitamin C daily from when the burn occurred to when you heal. That should also help perhaps expedite your healing process. And that is about it. To quick recap, we talked to you about prevention and prevalence of burns. I talked to you about how to describe and define burns. I told you the things that cannot be taken care of in the pharmacy setting. And for the things that can be taken care of, I went over the items or the products that would help you. And then we talked about honey and aloe and vitamins. And if you have any questions, please, 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 please feel free to ask. I would be more than excited to take in any questions. And until next time, you guys have a wonderful, wonderful day. Thank you and adios.